Hello. We have a really nice lady who is going next week, right? Early next week for a deep neck lift, and she's also going for an extended deep plane facelift. And this terrific patient has already had a few things. Quite a while ago, she had a brow lift, and she also had some eyelid work. And if you look at the pictures, you'll see the difference in her eyelids as you review the before and after pictures. But what we were just chit-chatting about was that when she was first looking and researching, and you had some cool sort of special sources of information about whatever the medical community in this region, shall we say. You were looking for certain maybe even personality characteristics, and you're trying to find a match. And we always reinforce this to our patients in plastics. It's like a match almost. So how did you learn about us, and what were you looking for when you started down this path?
Well, what I was looking for initially was I had such deep circles and bags under my eyes and all my life, and it really affected me in a lot of different ways, socially. Just, I had a complex about it. So that was the first thing I wanted taken care of. And just through the course of my job, I was a court reporter for like 40 years. I knew the medical community fairly well, and I knew who I didn't want to go to for this type of surgery. So I did a lot of research online, a lot of reading, and I looked at your CV online, and I see you're double board certified, which meant a lot to me. It really did. And how meticulous you are. I read your reviews and the accolades that you were getting about the amount of time you spend, whether it's in the office at the appointment or in the surgery itself. You go the extra mile, you take a lot more time, you're not in any hurry, and that really means a lot to me. And one of the big things is I don't want a procedure that's going to make me look plastic. That's not what I was after. You see a lot of these celebrities who have the money to go wherever they want, whoever they want to go to, and they come out looking terrible, in my opinion. I mean, too plastic. So I don't feel that I look that way from the procedure I had done on my eyes at all. I'm really happy with the outcome. And so after I had that work done, I'm just not real happy with the aging process, how this area here, it just needs lifted, and my neck. And I have a lot of faith in you that you're not going to make me look plastic. But then again, you're going to be able to tell that I had something done. I mean, after all, that's the purpose of it. So I just want to look a little younger and feel better about myself. I'm not expecting perfection, and I'm not expecting to look plastic either. From my research, I know that that's what you stand for.
I think you read us right. And obviously that's an unusual source of information. I think patients, they tap into the sources they have. A lot of folks go out to the internet. Some folks might talk to a few friends who maybe have had a few procedures or something like that. I think many people understand that that's sort of a small data set in a sense. If you go talk to your girlfriend or your neighbor or something like that. But people go with what they've got. I think patients are lucky nowadays. They do have, access to more information. You obviously had a unique vantage point.
Oh,
it sounds
absolutely.
Like 40 years of court reporting, and maybe you heard a few things.
And yes, I know the Pittsburgh medical community very well. Not just in facial plastic surgery, but that's another thing. You specialize in facial plastic surgery, not like everywhere else where you might want some work done, which that meant a lot to me too. So
we stick to our knitting. It's my own bias, and listen, we have a tremendous community of surgeons here in our town. I think it's, at least for me, maybe I'm more limited in what my capacity, but I think if I was trying to do, a dozen or 2 dozen procedures at world-class level, we want to do these procedures, cosmetic procedures above the shoulders, whether it be face neck lifts, which is real passion, rhinoplasty, eyelid work. Between those 3 procedures, that's 90% of my practice. And so we're not sort of dividing our attention. But listen, that's great. I mean, it's great to hear about that, unique information source you had, which partially sounds like led you to us. But we're looking forward to this procedure, and we'll give some further updates as she goes through her recovery. And I appreciate it so much.
Thank you.
You're welcome.